Losing hair can feel frustrating and scary, but here's the truth. You have options. Male pattern baldness, or androgenic alopecia as we call it in the medical world, is the most common type of hair loss in men. Now the good news is that science has come a long way when it comes to hair loss, and in this video I'm going to share with you 7 of my top tips that I generally recommend to many of my patients as an advanced medical practitioner and pharmacist practicing in family medicine. So let's begin. So straight on to tip number 1. The first thing I recommend everyone to do is act fast. All right, it's never nice seeing your hair fall, but leaving it too long makes things a lot harder. What happens with male pattern baldness is sensitivity increases. Certain hair follicles are far more sensitive to something called dihydrotestosterone. We call it DHT for short. So certain hair follicles, usually predominantly on the top of your hair and at the front of your hair, are far more sensitive to that, and then it causes miniaturization of the hair follicle, and when that miniaturization happens, that's eventually when we get hair loss happening. And when that miniaturization happens, by the way, we can't really reverse things. So acting fast is critical, and here's what you need to do now. So straight on to tip number 2. The first treatment I'm going to talk about is something called Minoxidil. It's been out for years. It's commonly used by many patients out there, and there's a lot of research supporting it. It basically boosts blood flow to your scalp and activates potassium channels. And this extends the anagen phase, which is the growth phase, meaning that over time you get thicker and healthier hair. I've had many patients that I've recommended to use Minoxidil in the past. Many of them have had a great outcome from it, but I have had patients as well in the past who've used it for too little. For example, they're expecting results straight away and not giving it enough time. Remember, Minoxidil takes about 6 months for it to show its full results, so you need to use it routinely. It's usually used daily, but obviously make sure you read the instructions that come with it and check with your healthcare provider that you're safe to use it as well. The other thing as well, I've seen in the past when I've asked patients, when I'm asking, how did you use it? Sometimes they're not actually spraying on their scalp. They're kind of just spraying it on the hair, almost like hairspray. So the most important thing is when you're applying Minoxidil or any other topical solutions that we talk about in this video, is really you need to apply it to the scalp and really sort of rub it in basically. That way you get more absorption, you get more blood flow, so it's going to be more effective. Straight to tip number 3, if you really want results when it comes to hair loss, I cannot recommend finasteride enough. Obviously speak to your medical provider again, make sure you're safe to use it, but it is very effective when it comes to tackling the root cause of hair loss. In short, it basically blocks something called 5-alpha reductase. This enzyme is responsible for the production of DHT, the thing that we spoke about earlier, which basically causes miniaturization of the hair follicles. Quick science lesson: DHT basically binds to the receptors on the hair follicles that are basically reactive to it, and it basically shortens the growth phase, and this makes the hair strands thinner over time, and eventually that hair follicle stops producing hair over time and we get the male pattern baldness. So think of it like this: with finasteride, we're actually able to stop that enzyme that produces the DHT. All right, so if we're reducing the amount of DHT, we're going to reduce the amount of hair loss. Oh, and by the way, if you want a powerful combination, you can use Minoxidil and finasteride together. Finasteride comes available as a topical form, so you can spray it as well. You can get finasteride and Minoxidil mixed together in one formulation that you can spray on the scalp and rub in. Finasteride is also available in tablet form as well. Obviously, these do need a prescription, so you will need to speak to your healthcare provider to make sure that you're safe and suitable to use any of the treatments we discuss in this video. Tip number 4, I've seen this in patients many times in practice. They start losing hair, they're seeing hair when they go for a shower in their hands, in between their fingers, when they're brushing their hair, and what ends up happening, they stop maintaining their scalp and hair health. So first of all, I want you to remember that it's normal to lose hair, okay? We all lose hair. We all lose about 50 to 100 hair strands every single day, and that's normal. So don't be afraid of doing your normal routine, washing your hair like you do usually, using your shampoo, using your conditioner, blow drying your hair, okay? Maintaining your scalp health basically, because if you stop doing that, your scalp health's going to get worse. And think of your scalp health like the soil basically, all right? And the hair is the plant growing from the soil. If the soil is not healthy, we're not going to get good growth either for our follicles, okay? So you need to maintain your scalp health. Moving straight on to tip number 5, let's talk about Ketoconazole. This is a really helpful helpful shampoo when it comes to hair loss. So you might have heard of Ketoconazole before. It's quite commonly used for dandruff, basically, because it's an antifungal. It's part of the imidazole family. But here's something you might not know. It actually helps reduce inflammation of the scalp and DHT activity at the follicles. So what you can do is start using Ketoconazole shampoo in combination with the other treatments that we've discussed in this video. It can be quite helpful. Remember, Ketoconazole shouldn't be used every day. You can use it 2 to 3 times a week. Make sure when you're using it, you're rubbing it nicely into the scalp so it can get its effect, and leave it on the scalp for about 5 minutes at least so it can do its thing. Now, if you want more information on all the different shampoos that are good for hair loss and hair regrowth and everything like that, we have a video on the channel where we go through in a lot of detail about the different types of shampoos, what's good, what's bad. So if that is something that interests you, at the end of this video, definitely go on to that video and watch it as well. I will leave a link to it in the description as well. Next up, let's talk about VERA Clinic. Based in Istanbul, they specialize in hair transplants and have performed over 40,000 procedures in the last 15 years. At VERA Clinic, your hairline is carefully designed and approved before the procedure. They offer follicular unit extraction, which we call FUE for short, and follicular unit transplantation, which we call FUT for short, along with the innovative Sapphire FUE, which basically uses see-through microblades for higher precision. This technique basically allows more implantation per session and enables compact follicle placement for a natural, denser look. The transplant is performed under local anesthetic, with grafts extracted, preserved and implanted for best results. Their packages include a 5-star hotel stay, 12 months of post-op care, and procedures done by their clinic's founding doctors. Don't forget to check out the link in the description below to learn more and to book a free consultation. VERA Clinic, thank you for being our trusted sponsor. Moving straight on to tip number 6, let's talk about low laser therapy. I know it looks futuristic, and it kind of is, but low-level laser therapy, we call it LLLT, basically uses specific wavelengths to stimulate hair follicles, increase blood flow, and basically help with hair growth. Pro tip for anyone watching, when it comes to the devices, there's usually 2 types out there. One of them is like a hair brush, like a wand basically, that you run through the hair on the scalp. The other one is a helmet. I prefer the helmet. I think it's a lot easier to use. I think the hairbrush style one is difficult to make sure that you get all the areas correctly. You might miss areas, you might not leave it on there for long enough. The helmet, you just put it on, click a button. It's usually on for like 10 minutes or whatever the programming is for it, but then wavelengths. And it does its job whilst you do your normal daily activities, okay? So I'd go for the helmet and make sure that you get an FDA approved device. Moving on to tip number 7, for those who are experiencing more advanced hair loss, then sometimes hair transplants can be quite helpful. Now, there are different types, like I said earlier, so you have FUT and FUE. I'm going to discuss FUE, so it's follicular unit extraction. So this is basically where hair follicles that are resistant to DHT are harvested first, all right? So basically, if you think about it, when you think of male pattern baldness, you generally think of the hairband that goes around the hair, because these hairs are basically far more resistant to DHT compared to these hairs. So basically, they harvest hairs usually from the back of the head in a strategic way, so it's not too obvious that they've harvested these hair follicles, and then they strategically implant them on the top of the hair or the front of the hair if your hairline's receding, to give that natural appearance. And when it's being transplanted, you usually have a shedding phase to begin with, but then after 3 to 6 months, you get that permanent growth. And I've seen countless number of patients who've had a lot of success with this, and even family members actually. So I thought I'd just give you a quick overview of this as well. So hair loss can be tough, and I really hope that you found this information helpful. So to summarize, we spoke about scalp health, we spoke about Minoxidil, we spoke about finasteride. Another thing that I like to always talk about is scalp massaging as well, trying to fit in 5 to 10 minutes of scalp massaging every day to get that blood flow. This can be really effective as well. We also spoke about hair transplants. We also spoke about low-level laser therapy. So we've gone through a lot of information. Like I said earlier in the video, if you do want more information on the different types of shampoos and lots more detail on shampoos and looking after your scalp health, we have a video on it. So I will leave a link in the description below. I just want to say a massive thank you that you watched our video. There's lots of videos on YouTube. We spend a lot of time to make sure that we're giving you evidence-based information that is clear and concise and easy to understand. So I really hope you found this information helpful. If you know anyone that would find it helpful as well, please share it to them. And as we say at the end of every single week's video, sending awesome vibes, and I'll see you next week.